Chances are that this year, 1 in 4 of these people will suffer a back injury. Some will be lucky. The injury will be minor and heal quickly. Others will not be as lucky and will suffer some form of permanent back injury. Either way, back injury is no light matter. The most common cause of back damage is unsafe manual handling, either at work or home. That is, unsafe lifting, lowering, pushing, pulling, and even shoveling. To better understand the reasons why we should always use safe lifting methods, let's examine the body in detail. The spinal column is the main structural member of the body. To it are attached the head and limbs, and from it are supported the other organs of the body. The column also provides a protective bony canal for the spinal cord, the great nerve trunk linking the brain to the rest of the body. Because man walks erect, the main direction of forces acting on the spinal column is vertically downwards. In this direction, the column has enormous strength. Moving in closer, we find that the spinal column is actually a series of bones stacked one on top of the other. These blocks of bone are called vertebrae, and between the vertebrae are special joints, allowing the column some flexibility. The joints are reinforced by sets of ligaments at the front, rear, and at the sides. The spinal column is held upright by the constant action of muscles, particularly those attached at various points to the vertebrae. Between adjacent vertebrae is the intervertebral disc. This disc acts like a shock absorber during normal activity. Each disc consists of a soft, jelly-like core surrounded by a tough, fibrous tissue ring. Pressure from the soft core forces the tissue ring outwards. The fibers of the outer ring are attached to the vertebrae, helping to bind them together. The range of movement of the spinal column in the lower back, or lumbar region, is fairly limited. And although we can bend forward easily, side and backward movement is restricted. Like mechanical systems, the spinal column is subject to wear and tear with age. The joints stiffen, while the discs tend to become less elastic and more prone to damage. Having seen how the various parts of the spinal column fit and work together, let's consider how the lumbar or lower back region can be damaged and abused by unsafe lifting. When the back is bent, the outer tissue of the disc is under considerable tension due to the distortion of the disc. If a sudden increase in pressure occurs, such as when lifting a heavy load, the outer ring may rupture in one area, allowing some of the soft core material to be forced out between the fibers. This breakdown is referred to, although somewhat incorrectly, as the slipped disc. This extrusion of material may occur quite suddenly, after years of incorrect lifting have weakened the fibrous tissue of the disc. The bulge of disc material may now press against a nerve, causing severe pain and discomfort. Although other parts of the back are subject to injury from unsafe lifting, damage to the disc is the most serious. In severe cases, surgery may be the only effective way to relieve the discomfort. To a lesser degree, a sudden stress to the bent back may cause acute stretching or tearing of the muscle fibers and the ligaments. Remember, in the straight position, the spinal column has enormous strength, the load being evenly distributed over the discs, ligaments, and muscles. Safe manual handling is based on simple rules, and these rules should be applied to every situation. Let's examine the key points in each of these rules. First, check area safety. Take a good look at the load and the area around it. Put on your safety gloves if necessary and remove any obstacles. Size up the load. Consider its weight, size and shape. Can you safely handle the load? If in doubt, get help. Place your feet and body correctly. With one foot forward and the other back, place the feet as close to the load as possible. In this position, you should be properly balanced. Take a good grip. Use the hand on the same side as the forward foot to grasp the top side of the load, while using your other hand to grip the underside of the object. With your head up and back straight, use your legs to raise the load. Once moving, don't allow the load to block your vision. Regardless of the size, weight or shape of the load to be moved, always follow the basic rules. Assess the load and check area safety. Position yourself properly so that the weight of the load will fall between your legs and you are properly balanced. Get a good grip. Use the palms of your hands, not just the fingertips. Your arms act as links, not as sources of power, so use those leg muscles and your body weight to raise and propel the load. Avoid jerky actions. Keeping your head up and eyes ahead will keep your back straight, and you'll also be able to see where you're going. Bill is an experienced lifter. He knows exactly what he can safely lift. He also knows that his ability to do his job depends on his avoiding injury through careless lifting. Remember, think about the load you're going to move and the safety of the area in which it is located. Position yourself correctly for the type of load to be moved. Take the proper and safe hold. Keep the back straight and your head up. Use the legs to do the work. Make sure that the path you intend to take is clear. No matter what your situation, following these simple rules will go a long way to preventing back injury. Think ahead. Think back. The principles outlined in the film No Light Matter apply to all patient transfer situations. However, the patient's safety and consideration for the patient's medical condition assume special importance. The patient must not be moved until all is in readiness for the lift, and the following steps are observed. Assess medical hazards. Determine whether the lift requires one or more lifters. Decide on the most suitable lift to use. Appoint a leader to ensure a coordinated lift. Explain the reason for the move to the patient and try to obtain maximum cooperation. It's good therapy to have the patient assist as much as possible, but it's good safety practice to talk the patient through each stage of the transfer. Lastly, nursing requirements must be considered before the lift is attempted, as this may modify the lift. The Australian shoulder lift is one of the most widely used and requires some assistance from the patient. This lift allows the weight of the patient to be brought close to the lifters, who then use thrust from the thigh and leg muscles to transfer the patient. Let's examine the lift in detail. The lifters stand at each side of the bed with their rear legs opposite the patient's hips, feet pointing inwards. Their legs are spaced well apart for stability, the front feet pointing toward the head end of the bed. The patient is raised to a sitting position using the conventional underarm lift. That is, the inside arms are placed under the patient's armpits with the hands around the top of his shoulders. The outside hands are placed on the shoulder blades for support. In one smooth movement, the lifters bend their knees, place their shoulders into the patient's armpits and link hands under the upper thighs. The patient rests his arms on the lifters' backs while they place their outside arms on the edge of the bed. On an agreed signal, the lifters move the patient by straightening their rear legs and transferring weight onto their forward feet. During the transfer, the lifters should look straight ahead and maintain a straight back. Because this lift requires some assistance from the patient, it should be avoided when the patient is suffering from a painful chest or shoulder condition. The cradle is a useful lift when handling weak or limp patients. The cradle is not as safe as the shoulder lift, as the lifters are not able to handle the weight as efficiently. For this reason, the cradle should be avoided when handling very heavy patients. The initial position of each lifter is identical to that adopted in the shoulder lift. The patient is raised to a sitting position using the conventional underarm lift, and at the same time his knees are raised. The lifters face in toward the patient, bend their knees, and link their outside arms behind the patient's lower back. Their other hands are linked under the patient's upper thighs. On a predetermined signal, the move is effected by the lifters straightening their legs and transferring weight onto the leading foot. Once again, the lifters should maintain a straight back. Where only one lifter is available, it is considered medically safe. The patient can assist the lifter by using an overhead ring to take a large part of his weight during the transfer. One lifter can then safely move the patient up the bed using a shoulder lift. However, this lift should be attempted only if the patient can be trusted to maintain his grip on the overhead ring during the transfer. The patient is first raised to the sitting position using the underarm lift with some assistance from the ring. The lifter then adopts the shoulder lift position, but effects a smooth transfer by straightening her rear leg and transferring weight onto the lead foot. The patient assists at the moment of transfer by raising himself and pushing off with his leg. It's important that the patient is talked through the lift to ensure maximum cooperation and effort. When dealing with an elderly or disabled patient, and it's desired to use a ring-assisted lift, it is safer to use the cradle position. Should the patient relax his grip from the overhead ring during the transfer, the lifter still has some measure of control over the patient. This would not be the case should the shoulder lift be used. The patient is brought to a sitting position using the underarm lift. At the same time, he raises his knee. The lifter bends her knee, places one hand under the patient's lower back and the other hand under his upper thigh. The transfer is achieved by the lifter straightening her leg and shifting weight onto the lead foot. At the moment of transfer, the patient raises himself using the overhead ring and pushes off with his leg. In this situation, the cradle gives the lifters very good control over the patient. However, their visibility in the direction of travel is slightly reduced. Cradle lifting of very heavy patients should be avoided. Let us now analyze the lift. The wheelchair should be placed as close as is practical to the bed without becoming a hazard to the lifters. The patient is raised to a sitting position using the conventional underarm lift and is swung around until his legs hang over the edge of the bed. If the patient is small, it may be necessary to first draw him to the edge of the bed before the lift. Special care must naturally be taken with chest or shoulder injuries. The lifters link their outside hands under the patient's thighs and at the same time lock their arms behind the patient's lower back. On an agreed signal, they lift the patient by straightening their legs. The lifters turn toward the wheelchair, stabilize over it, and gently lower the patient by bending their knees and hips, not their backs. The two-person cradle lift may be used in a variety of situations. And in this example, the patient is to be transferred from a wheelchair to a chair. The wheelchair is placed as close as possible to the chair without becoming a hazard to the lifters. The brake is applied and the footplate folded away. The patient is eased forward, special care being given to any chest or shoulder injury. With the knees well bent, the lifters link their outside arms under the patient's lower thighs and at the same time lock their arms under the patient's lower back. On an agreed signal, the lift is effected by the lifters straightening their legs. They move smoothly to the chair, stabilize over it, and gently lower the patient by bending their knees. When handled correctly, the cradle lift position gives excellent control and promotes a sense of security in the patient. The weight of the patient is close to the lifter's body, ensuring a straight back posture and providing a safe transfer for both patient and lifter. Should a patient be unable, either through injury or illness, to use one leg, the tango or bear hug is a useful method of transferring such a patient from the bed when only one lifter is available. In this example, the model is assumed to have lost the use of his right leg, but otherwise to be in reasonable medical condition. The patient is raised to a sitting position using the conventional underarm lift, and his legs swung over the side of the bed, the patient using his right arm for support. The patient is then eased to the edge of the bed. The lifter places her thigh between the patient's knees, places his left arm over her right shoulder, and locks her hands behind his back. She draws the patient off the bed and by a series of small steps maneuvers the patient toward the wheelchair. Once the patient has again supported himself, the lifter releases her grip and gently lowers the patient into the chair by bending her knees. The following sequence demonstrates the basic cradle lift being used to lift a wheelchair patient in and out of the bath. The patient is transferred from the wheelchair to the edge of the bath using the conventional cradle lift. The patient is gripped firmly under the armpits and knees to control his movements. Special care should be taken when the patient is removed from the bath, as he will be wet and slippery. The patient is usually dried off in the wheelchair. The following demonstrates the most commonly used lifts when transferring a patient from a trolley to the bed. In this type of lifting, it's imperative that the lifters work in unison and the leader talk through each stage of the lift. The lead foot of each lifter is placed well under the trolley and the knees well bent. On the agreed signal, the patient is eased to the edge of the trolley, then smoothly lifted, being held against the lifter's chest. While moving to the bed, the patient is evenly supported by the three lifters. A fourth lifter should be used when transferring a patient with a spinal injury. The fourth lifter supports the head and neck to avoid unnecessary movement and the possibility of further injury. An unconscious patient may be safely transferred from the trolley by leaving him on the stretcher. The trolley is carefully positioned to facilitate the lift and reduce walking distance. The bed end can be removed, as demonstrated in the second example. Let's look at the type of lift that may be used to move a semi-conscious patient who has fallen beside his bed. It is stressed, however, that under no circumstances is the patient to be moved until it has been determined medically safe to do so. The patient is positioned on his side so that a blanket may be placed under his body. He's then drawn away from the bed to allow easier access. The blanket is rolled up on each side of his body to form a better gripping surface for the lifters. On an agreed signal, he is lifted from the floor and carried carefully to the bed. The lifters allow their arms to extend fully when carrying the load. The blanket is removed by rolling the patient on his side. The mechanical hoist can be used to reduce the burden of lifting a conscious patient from a bed or chair, and its use is highly recommended where practical. Firstly, the supporting belts are placed in position by rolling the patient on each side in turn. One belt is placed under the shoulders, the other under the buttocks. The hoist is then wheeled into position and the arm lowered so that the belts may be clipped onto the hooks. The patient is asked to grasp the hoist arm for added security and is raised clear of the bed by winding up the hoist. The hoist arm is swung around clear of the bed and the hoist positioned to allow the patient an easy descent into the chair. When using the hoist in any situation, it's important that the patient be made to feel confident and secure in the operation of the hoist. The upper belt is removed, however the lower belt is usually left in position to avoid disturbing the patient unduly when the hoist is used for the return trip. The hoist is ideally suited to allow certain types of patient toilet facilities. The toilet chair is firmly locked in place on the hoist. The hoist is then positioned alongside the bed with one wheel inside the bed leg to prevent movement. The chair is positioned slightly lower than the level of the bed. The patient supports himself using the overhead ring and the outside arm of the toilet chair. With the assistance of the lifter, he moves across into the chair. When the patient wishes to return to bed, the hoist is positioned so that the chair is slightly higher than the level of the bed. This allows a smoother downward transfer using the overhead ring and assistance from the lifter. Within the confines of the ward and whenever time permits, the use of the hoist is highly recommended. The lifting techniques demonstrated in this film provide safe and practical methods of transferring patients in a variety of situations. The basic principles of lifting, as outlined in the film No Light Matter, should always be applied. Follow those principles and help reduce the risk of back injury to yourself. Think back. The film No Light Matter explains the basic principles of safe and efficient manual handling. Object lifting now looks at some everyday situations in detail. But before examining these lifts, let's go over the factors you should observe before attempting to move any object. Check area safety. Size up the load and observe legal weight restrictions. Position your feet and body correctly. Take the proper grip. Keep your back straight and head up. Use your legs to do the work. Ensure that your intended path is clear. The feet are placed apart and as close to the bag as possible, the forward foot pointing in the direction of travel. The knees are bent, the bag is grasped by the top corners and raised to a vertical position. The feet are repositioned and the bag is twisted sideways. The lifter then tilts the bag forward and grips the underside of the bag with his right hand. He looks up and lifts the bag by straightening his legs, the load being held close to the body. Looking up at the moment of lifting will ensure a straight back. The lifters position their feet as close to the bag as possible, with their forward feet pointing in the direction of travel. Both lifters drop by bending their knees and firmly grasp the bag at each corner. On an agreed signal, the bag is raised by the lifters simply straightening their legs and maintaining a straight back. They move off in unison, looking in the direction of travel. The feet are placed apart for good balance and stability. The shovel is held near the midpoint of the handle, palm up. The other hand grips the top end of the handle, palm down. To shift the load, the shovel blade is driven under the material by bending both knees and thrusting forward using body weight. The load is withdrawn and lifted by straightening both legs, pushing down with the rear hand using the thigh as a pivot point and raising the forward arm. The shoveler maintains a straight back throughout and looks in the direction of load delivery for safety. His stance allows him to maintain an even, steady rhythm and so conserve energy. The feet are placed apart for good balance and stability. His forward hand grips the shovel toward the blade end, palm up. The other hand grips the handle, also palm up. His knees are well bent, and the blade is thrust forward, his thigh pushing against the forearm to drive the blade under the material. The blade is withdrawn by straightening the legs and lifted by thrusting with the rear arm. The natural twisting action of the wrists allows the load to fall from the shovel. The body should face toward the material to be moved, this stance allowing a smooth, even rhythm to be established. The operator places both hands on the trolley handle, palms down, and applies rearward pressure to swivel the wheels into alignment. As he does this, he bends his right leg, transferring his body weight to the rear. Having checked that the intended path is clear, he sets the trolley in motion by a steady thrust from first his right leg, then both. The operator maintains a straight back when pushing and does not jerk to start the load moving. The operator grasps the trolley handle firmly with both hands, palms down, and applies forward pressure to swivel the wheels into alignment. He then transfers his body weight rearward by dropping back. The trolley is set in motion by a steady thrust from both legs while the back is held straight. It's important that the path is checked before moving off, as the operator will have difficulty seeing where he's going once in motion. The feet are positioned to give balance and stability. The forward foot pointing in the direction of the load, the body at a slight angle away from the load. The drum is eased to the edge of the shelf and then supported by the inside hand, while the other hand drops down to grip the underside of the drum, palm up. The lifter repositions his inside hand around the top side of the drum for a more secure hold. The drum is eased off the shelf and allowed to fall smoothly, fully extending the outside arm. The lifter's body is now facing in the direction of travel, and he moves off, the load held close to his body. The load is carried at arm's length and close to the body. The lifter approaches the stack, bending his knees just before the lift. The load is lifted by him straightening his legs and rising up on the ball of the rear foot. The drum is given additional lift by a thrust from the thigh. The lifter must time his movement to the shelf so that the lift is performed smoothly in one continuous action. The technique of lifting a bag to and from a chest-high shelf is the same as when lifting a small drum. However, with this type of load, an apron should be worn. This common lifting situation is seldom handled correctly. The box is carried at arm's length and held close to the body. The lady places the box on the bonnet so that the car door can easily be opened and the front seat folded forward. Her feet are placed as close to the car as possible, the knees are well bent, and the back is kept straight. The box is placed on the rear floor while she alters the position of her feet to maintain balance. The box is then moved onto the rear seat. Handled in stages, this lifting technique is both safe and efficient. Although there are many and varied lifting situations, the basic rules always apply. Follow these rules and reduce the chance of back injury. Think ahead. Think